make your team. Together they're a power dream. The doctors are in, let the show begin. Double the wisdom, double the grin. From the courtroom to the ER spin, they've got the cure, let's dive right in.
Ladies and gentlemen, theys and gays, welcome back to The Doctors Are In, the show that's 2 degrees hotter than your average podcast.
I'm Kelley Sharp, a dermatology resident on the East Coast.
And I'm Amanda Sharp, an attorney on the West Coast, who likes my drinks without ice.
And we're the Sharp sisters. Twin sisters born and raised in the Midwest, now living on opposite coasts, pursuing our professional dreams.
We're going to start the podcast right off on the most asked question from the last episode. Everyone wants to know why the logo is 2 white men. It's valid. We should have maybe discussed in the first episode, but we're going to kick this one off by addressing it. So when we first had the idea for this podcast, we decided to get artificial intelligence involved because we're a lawyer and a doctor. We were not equipped to produce a podcast. So I went on AI and I said, hey, can you make us a logo? And I gave it the specifications of it's twins. One is a doctor, one is a lawyer. And I don't remember what else I said, but I didn't give it genders. I didn't give it races. I didn't give it anything. So I think AI should have come back to me and asked some clarifying questions, because now that I know how AI works, this was like last summer that I did this image. AI is a lot of the time asking me follow-up questions when I give it stuff for work or anything else. So instead, it just says, yeah, got it. I'm going to do that for you, Amanda. And it spits out this image that you see that is now our logo. And I was quite astounded, I have to be honest. When I saw it, I don't know why, but I just thought we were past this. I thought we were more progressive. And I don't know what I would have preferred it had just automatically given me. But I was disappointed. And I think it's a good narrative on the social bias and how we always just assume men are the doctors and men are the lawyers and it's never women. So I thought it would get people asking questions. And we were right. It did. Everyone asked us why that was the logo. So that's the story. AI created it. We've continued to adopt it because I think it's a good commentary on the social bias that still exists. And part of why we started this podcast.
Yeah, we should ask AI a year from now and see if it does better. Ask more questions. It's definitely not representative what doctors and lawyers look like.
No. And it also looks like John Hamm. Like
it
John
does.
Hamm is a unofficial sponsor for the podcast. But I want to do twin triage. Let's start it off with that. And I know, Kelley, it's been a couple weeks now, but you were in Kansas City. You got to go to 1587. I've heard a lot of reviews about it. Wanted to get your personal take since you've actually been able to go and experience the ambiance.
It's really cool. So it's at the Lowe's Hotel downtown Kansas City. So the vibe immediately is really nice. You go into the Circle Drive, there's a valet in the entrance to the hotel, and then the restaurant are right there. You tell them your name, reservation, they've got people standing at the door. So unless you have reservation, you're not getting in. It's very kind of high end from the get-go. And you walk in, it's very luxurious. There's like marble, velvet everywhere. It feels like honestly a restaurant in New York City in downtown Kansas City. So we sat upstairs. Downstairs, they had a bar area, and the person doing live music was actually on a wireless mic. And so throughout dinner, they were walking around the restaurant. So she was upstairs, she was dancing, singing, super high energy. She was really, really talented too. That was kind of the general vibe, ambiance. The waiter came over, gave us all the specials, gave us the rundown, and everything we tried was really excellent. So we got steaks, tried each of the salads, which were giant. And then some things I would have loved to try, but we were super full, would have been the burger and pasta. It looked really great too. All the desserts looked excellent. We were way too full. Their wine list is insane. So start to finish, it was a really amazing experience. Kansas City is so known for their steaks and their beef products that I was really anticipating that would be a standout. And it was very, very good. But some of the things I liked the most were actually the sides, the appetizers, the starters. Patrick Mahomes is a catch-up trio flight. So I did order that special to have with my fries. That was fun. So in general, like a really excellent vibe. I think it's going to do really well. It's something that like the area needed, and it's super cool to support local people doing that.
That's amazing. And for those people who aren't from Kansas City, can you tell us what 1587 is?
Yeah, so 1587, those are the numbers for Patrick Mahomes 15, obviously, Travis Kelce 87. They've opened the steakhouse together. And there's actually inspired decor throughout. So the light fixtures are supposed to look like little X's for the football A's. And then some of the lights are kind of more like a football shape, so they're paying homage. There's 1587s in throughout the tile, different places. So you can sense there's the incorporation of the Chiefs are there, but it's not sports memorabilia hanging on the walls. So it's done in a very nice way. But if you know, you know, and it's very much a key component of how the steakhouse has been built.
Like a high-end sports steakhouse.
Yeah, it's very high-end. It's really fun. It's just impossible to get a reservation. So if you can, I would definitely go. Otherwise, get on the wait list. I think eventually, maybe in a year or two, things will settle down. It'll be a bit more accessible to get in, but we'll see.
Yeah.
Yeah.
Yeah, and in the last couple of days, there's been a massive snowstorm. I think its name is Fern. They've been calling it Storm Fern.
I
Have you
don't
heard this?
know. No. So the one that came through last weekend was Benjamin. I know who
Wait.
Fern is.
I am on the West Coast and I didn't get the storm. So, Snowstorm Fern. It sounds like that was wrong. I'm glad we're coming straight to the source for this. Storm Benjamin.
Fern?
I think so. Like a plant.
I don't know if this is the one happening now. There is a large bomb cyclone that's off the eastern seaboard that's impacting like the Carolinas farther south right now.
Oh, yeah. They were talking about Cape Cod might get covered. Maybe that's Fern.
Yeah, so
and
it's
this
like
was
the-
Benjamin.
Benjamin was last week, which is crazy. Fern might be the bomb cyclone, but it's wreaking havoc in the mid-Atlantic and the southern states right now, which is really
This is
bad because they
probably-
also got hit with Winter Storm Benjamin.
This is definitely why they named them, because people can't just say, oh, that's snowstorm. They need to
I
say
know.
storm this. Okay, so tell us about Storm Benjamin then.
It was crazy. I love meteorology. I think if I hadn't been a doctor, I would have got into meteorology. I think the weather's fascinating, but it was a very large storm system that hit us. It was pretty slow moving too. So literally for 24 hours, we got snow. And I've never seen so much snow accumulate in a single period of time. But where I live, we got 17 inches in one day.
Damn.
And it's been like frigidly cold. So I think we had a 2-week period where it's not going to get above freezing. So the snow was
Wow.
accumulating and then not melting. And so obviously in the Northeast, we have really good protocols in place for moving the snow. The more southern states also got a fair amount of snow and then also a lot of ice. And so they were completely closed basically for the whole last week because they just can't get out of the ice. So that was not great. But for us, we just got mostly snow and it was very cold. So I was learning about how the cold and like the ambient temperature impacts how thick the snow feels. So the colder it is, you have less water content. The snow actually feels lighter and fluffier versus that denser, heavier snow when you have more water. So the same volume of snow falling can look differently in terms of how many inches, just based on how fluffy it is. So we had a very dry, very
Wow.
cold snow. So it was very voluminous as well. It was very interesting. Liberty, my dog, she's about 1 foot tall. She hated it. Like trying to go out in the snow immediately was just falling into it. So we were trying to keep her inside as much as possible. But luckily, I didn't have to be in the hospital over the weekend, which was really nice. Really thankful for everybody that was there. So, but yeah, it was a lot. It was a lot.
That's crazy. Also, we might
Yeah.
have to have a segment where you do weather, because I did not know this about you, that meteorology
Yeah.
is
I love the weather.
a passion.
I love it. I check it all the time.
Wow.
I check it all the time because that's how I know we were almost going to get hit by the bomb cyclone and then it moved away.
You knew a lot about that. So maybe they should have you be one of those on-site reporters
I would
coming
love it.
live to you.
I just think it's cool.
That's crazy. I'm sorry that you're
But
going through that
How
weather.
was your weather today?
It was hot today. It was around 80. I was complaining. You know, the grass is greener. So I used to live in Kansas, loved coming to San Diego for trips, thought it was great, loved the weather, thought it would be amazing to live there, and it is. But at the same time, part of me does just want there to be some kind of glitch where there's a bad day. It's not realistic
Yeah.
to have a good day every day. And when the sun is always shining, it feels like you have to have a good day every day. Speaking of Liberty, I want to do Healthcare Heroes shout out. I know you wanted to give a shout out to some special folks in your veterinary office.
Yeah, no, Liberty was down bad about 2 weeks ago. We had been out of town, so we had her stay at local kennel. We think it's kind of like daycare. The dogs, they go get sick, like you were saying, Cooper, there, they got a little bit of a kennel cough type situation. I think that's kind of inevitable, but Liberty, she's a Frenchie, and so doesn't have a lot of reserve in terms of breathing ability on the best case scenario, and she got a little kennel cough type of respiratory thing. She was coming home a little bit sniffles for a few days and then got progressively more congested, like wasn't going away like it normally does. She was like in her mouth. It was really scary. And so she ended up having to be admitted to this animal hospital in our area. So she was there for 5 days. It was really scary. She was like in the ICU level care for this animal hospital. And she's doing a lot better now. She's like to being herself, playing. So I was just really, really thankful with the care that we got. It was a really wonderful veterinary center here in Connecticut called Bolton Vet, and they were just exceptional, took great care of her, literally saved her life because she was not doing well. It was really scary, so definitely shifted my perspective a little bit on how we'll be taking care of her when we leave in the future. It was scary. I didn't like it.
Yeah, well, we will link to them in the show notes, just to their website. So if anyone's in the Connecticut area and has
they're
a
top
Frenchie
notch.
or any dog, I know Cooper, he had kennel cough during Christmas week, and he's still literally today. We went on a 2-mile run, and he's been coughing up stuff all day. And this is almost February.
It lingers. It's tough.
Yeah.
Yeah.
Yeah. I have to hit him on the sides and help him kind of get it up because you
Mm-hmm.
can hear him like breathing, but I can't imagine with Liberty where she doesn't have any of that snout.
Yeah. That's called copaging. I learned about that. Is helping them. You can like put them in steam. I got really acquainted with steam showers and locking Liberty in the bathroom when I would take a shower, and she would get the steam, and then you're supposed to press on their chest to break up the mucus and help them get it up. Oh, hi, Cooper.
Oh, you're gonna cough right now, huh? You're gonna cough right now? No. Wait, did you hear that?
No.
That would have been really fitting if he had coughed. Wait, hang on. Let me do this. What's it called? Copaging?
Copaging, yeah.
Okay.
God.
I
It
know,
sounds
it's
like
just seriously still down bad. Wow, well, I'm really grateful that you have a vet that you can go to. It is super important
Oh my gosh.
for personal,
Yeah, no.
but also for little animal health.
Yeah. But I know that you've had some interesting experiences with healthcare recently. A couple shout outs you wanted to do.
Yes, I did. So I have a hip injury. I'm not sure exactly what it is. I've been working through it. I did yoga. I did a lot of stretching. At first, I thought it needed to pop. And I think what I did that I wouldn't do again was stretch it intensely for 4 or 5 days in a row, thinking I would just be able to get it. If I moved a certain way, it would pop and then I would feel better. I think I actually made it worse. I think I was straining whatever it was. So I ended up reaching out to one of my family friends, Greg Ninberg, who's a chiropractor, and he brought me into his clinic, Delta Chiropractic. I'll link that in the show notes as well. But he has been seeing me like 2 times a week for the last couple of weeks, and we've come to the point where he thinks physical therapy might be the best bet. But I really appreciate him taking the time to just see me, give me an analysis, and then being honest with me, because a lot of the time people mistrust medical professionals because it's very easy to get someone in the door and then keep milking them for money. And Greg's not charging me at all, which I really appreciate. But at the same time, I know there's only so much he can do, and it's frustrating when you go to someone, you want them to help and they want to help and they can't. But I really appreciate him, so I wanted to give him a shout out. And then I shouted out Ovelity last time, and Kelley knows I got new insurance for a new job. And my Ovelity, which is around $1,200 when insurance doesn't cover it a month, got denied. And I had to submit a prior authorization, but that was a whole thing as well because my former PCP wasn't qualified under my insurance. Anyone who's ever had to switch insurance and has some kind of medical thing, I'm sure you could relate. But it was very frustrating. And between calling my former PCP, my PCP's office from when I used to live in Kansas, to my insurance company, it's just been a huge headache. And one of the things I would like to say, I know Kelley knows this, and everyone who is medical has probably heard this, or if you want to go to medical school, listen up, because I actually got notification today, this morning, that I was approved for prior authorization. And probably the only reason my insurance company did that was because I had good documentation to show that I had tried previous antidepressants for a while. They worked and then they stopped working. And it was very important that the doctors I went to documented that and said, hey, this patient came in feeling more depressed, having more of these symptoms. We switched medications. We're going to do a follow-up. And you as a patient hear that and you're like, I don't want to do a follow-up. Like, I'm tired. Just give me the medicine. I'll feel better. But it is super important that we as lay people and you as doctors listen to each other and make sure all that stuff is documented, because if it hadn't been, I probably wouldn't have been approved for that. So Dr. Eliason was my PCP in Kelley's since when we were young, like 2012 to 2021. And she ended up switching to a different hospital. I moved out of the state. She didn't take my insurance, so I couldn't keep going to her. But she's probably the reason I was able to get it, because she kept such copious notes when I was a kid, first figuring out I had depression and trying different things. So that's my shout out. My healthcare hero is Greg Nimberg and Dr. Christina Eliason, the real heroes of the field. And any future current doctors, make sure you document, because it could be the difference for your patients.
Yeah, no, there's a saying in medicine, if you don't document it, didn't happen. And it's so true.
It's so true. Like, how am I supposed to track down my PCP from high school now as a 30-year-old and get her to write something that says, hey, 2013, you didn't like Lexapro, so you switched to Wellbutrin. Oh, I don't remember that. Like, how's she going to remember that?
Yeah.
But that's why we document.
That's true. I completely agree. PSA, if you didn't document it, it didn't happen. And now switching gears a little bit to one of my favorite segments, craziest shit we've heard this week.
This week, I heard this headline: Patagonia sues drag queen Patty Gonia for trademark infringement. We will link the different stories I've seen floating around as well as the complaint, which we'll kind of go over. But this is wild. At first, I heard it. And as someone who's in the LGBTQ community and thinking Patagonia is this pretty progressive brand, I was like, there's got to be something here, because there's no way their legal team is trying to bring down years of goodwill with the community. And as soon as I heard this, I was like, I'm going to go read the complaint, which is what real legal nerds do, because that will give me the most up-to-date information. If it's a good complaint, it's going to have all the main facts. It's going to have evidence of who said what. And I'm going to know at the end of that where we stand as of today. So that was the case. And just a little TLDR for everybody. So Patagonia, if you haven't heard of it, I think that's unlikely at this point. Let's be honest. They've been around for like 55 years. Where have you been? But they first registered their P6 logo, which is that logo of the Patagonia Mountains. I'll show you in a second. You'll know if you're listening in audio what the Patagonia logo is, because they've done a great job of promoting it and protecting it. And it's become incontestable at this point, which if you file for a trademark as a company and it goes for 5 years and nobody challenges it and says, hey, it's really hurting our brand, it becomes incontestable. You can't challenge it anymore. So they registered the P6 in 1984. So in 1989, if I'm doing math right, since then till now, it's been incontestable. Nobody can challenge it. But in 2024, Patagonia alleges that Patagonia, the drag queen, started using its brand and logos, which are trademarked, and that's causing consumer confusion. So I read the complaint. In 2022, Hydro Flask wanted to do a collaboration with Patagonia, the drag queen. So they reached out to Patagonia, the company, to just make sure there was no bad blood, that there wasn't going to be trademark implications, because they wanted to support Patagonia, but they didn't want to piss off Patagonia. And in the complaint from February 2022 is this email thread from Patagonia to Patagonia saying, hey, we want to allow this, but we just want to make sure we're on the same page. You're not going to use any logos or branding that looks like our logo, because we have to protect that, because otherwise it becomes generic and we don't have protection over our brand anymore. And Patagonia said, love it, like 100% on board, basically. But then, flash forward to February 2025, there were some emails in the complaint between the parties again, where Patagonia has been showing this logo, which we'll show in a second. And it's eerily similar. I have to be honest with you. It's infringing. There's no other way around it. You'll see. February 2025, there's this contentious email. And basically she's like, no, we never agreed to that. You partnered with bad brands and we've never wanted to be associated with you because of that. I read it and I was like, wow, this is going to become a documentary.
That's wild.
So then in September 2025, Patagonia filed to trademark her name, despite saying previously she was not going to. And Patagonia has a long history of defending their mark. In trademark, it's very important that, you know what Velcro? Do you know what the generic name for Velcro is?
Oh my God.
No, you don't. No one does. It's called hook and loop. And Velcro, hook and loop is what Velcro actually is. Velcro is a brand.
I didn't know that. I thought it was just a material.
No, I did too, until I took trademark law in school. There's a whole video on YouTube. We'll link to it.
That's crazy.
The Velcro employees do this song where they say, call it hook and loop. This is Velcro. This is our brand. You're causing it to commit genericide, which means it's becoming generic and we can't have it as a trademark anymore. So Velcro is actually hook and loop. And then what was the other one? There was another one I wrote down. Kleenex. Yes. So
I get Kleenex. Like, that's like facial tissue, right? Like,
exactly. Like tissues.
Or even Google. Like, you Google it.
Exactly.
Yeah.
So Velcro is the worst one, though, because you have no idea what hook and loop is. So that's why.
Did you know that Botox is actually a brand as well?
What's Botox called generically?
Botulism toxin. But yeah, Botox is the brand name of it. So you're like, I'm getting Botox. You may or may not be getting actual Botox. Yeah.
The more you know.
The more you know.
That's crazy. So this genericide discussion is all to say Patagonia is trying to ensure that their brand does not get diluted to the point of becoming generic and then they can't protect it anymore. So from a trademark perspective, as someone who's a super IP nerd, I totally support them. And after having read the complaint, they literally said,
yeah, it seems sus.
To maintain our own rights, we must prevent others from copying our brands and logos. If we do not, we risk losing the ability to defend our trademarks entirely. To put a finer point on it, we cannot selectively choose to enforce our rights based on whether we agree with a particular point of view. Inconsistent enforcement might prevent us from stopping entities like the oil and gas lobby, counterfeiters, the hate groups, or other bad actors from using the Patagonia name and logo. These are not hypothetical examples. They are real instances of past trademark infringement we successfully stopped only because we have been consistent in defending our rights. And then they went on to say, we're not against art, creative expression, or commentary about our brand. We want Patty to have a long and successful career and make progress on issues that matter, but in a way that respects Patagonia's intellectual property and ability to use our brand to sell products and advocate for the environment. So reasons, I'm on Patagonia's side, the plaintiff. They very clearly documented that they tried to settle this without a lawsuit prior to filing it. Patagonia, for I'm sure personal reasons, as well as probably thinking that she is in the right on a lot of things, didn't see it that way. But it seems like there are previous communications in the complaint between the parties that Patagonia wouldn't use Patagonia's logo, like the Hydro Flask example in February 2022, as well as Patagonia mentions multiple times that they support Patagonia's, her mission, message, and objectives in helping raise awareness for LGBTQIA Spirit Plus causes, as well as environmental issues. But they have to do this to protect intellectual property as a due diligence for the brand. So quickly, before we move on from this, I want to show you the thing because I think it's so fascinating. And if you're like totally bored, just skip, I don't know, 3 or 4 minutes down the road. Let's see, here we go. Okay, can you see this? I can. Oh my God, exciting. Okay, so we can just ignore my like little annotations here.
50.
This is how I did all of law school. But anyways, they'd say like, we support advocacy and activism, promote the environment. For all these reasons, we must protect it, whether we support or agree with her messages. And then like, here are some of the images. They're not really infringing, in my opinion.
These, yeah, I mean.
But here's where we really.
Oh yeah, no, that's bad.
Yeah, that's pretty bad. And like, and then people start commenting too. That's how they're using this to show the consumers confused, because that's why trademarks exist, so that consumers don't get confused. We protect them. The parties, jurisdictions, and venue is a really great read if you're a law student and you want to understand how that shit works, because this is really cut and dry. And I never understood how that worked when they would talk about the crazy cases that had nothing to do with things I was interested in. But this is a good read and it's quick. But here's their initial logo that's kind of the biggest thing at play. And then they talk about how they've spent an enormous amount of money trying to protect it. They have goodwill in it. And then here, it's like February 2022 email. Then fast forward to 2025, Patagonia is like, hey, we are coming a little more formally this time. Like, some of these things are pretty egregious infringements in our opinion. And then Patty literally goes, this email was incorrect. It's inspired by a region in South America. All of these things were done as fan art, which I thought was an interesting case, but then she starts to wear them and promote them on her social.
Yeah, so it clearly is like being adopted by the brand.
And then we intend to avoid any perceived association with the Patagonia brand because they had this like lost arrow threat. There was a whole thing, read about that if you want to, but it got pretty spicy and contentious. And then she ends it by saying, we want to make sure there's absolutely no brand association between Patagonia and the brand Patagonia. We won't save any of the brand Patagonia's products we frequently find heading to the landfills, because I guess Patagonia's brand saves these products and repurposes them.
Oh,
so
man.
It got spicy. Things got crazy.
Wow.
And they're really, here's some of the other things they've pursued claims against.
I feel like I definitely saw that.
Yeah.
In Greek life, for sure. Stuff like that.
And at the end of the day, the biggest thing is they're only suing for $1 and they want permanent injunction.
So it's not like punitive. It's just supposed to be protective of the brand Patagonia.
So you can ask for different damages when you file a lawsuit. Patagonia is literally saying, we just want $1 in compensatory damages and we want a permanent injunction so you can't use this anymore. And now here we're going to show you, okay? Do you think they look similar?
They do. I do like the Patagonia. That's really excellent.
It's great. It is. There's nothing wrong with it, except for it's very much infringing.
Yeah.
It's like the same logo. It's the same lowercase.
It's the same font.
It's the same font. Yeah. So, anyways.
No, it is. Yeah.
At the end of the day, I think I'm on Patagonia's side, but that was some crazy shit I heard this week, and I just had to talk about it.
That is crazy. That is crazy.
It was crazy, and I think a lot of the time people don't know how to talk about drag queens, and they want to think someone who's filing a lawsuit against them is maliciously doing so because they're not a supporter of the community. And I initially thought that as well, but having read this, it's very clear that Patagonia wants to extend the olive branch of, hey, we are totally supporting this, and we want you to go out and be who you are and support the same causes that we support, but you can't do it the exact same way that we do. Otherwise, you're going to confuse consumers, and that's what trademark is here to protect.
That's fair. Can I also just say, I do love a Hydro Flask. That is something I think we need to talk about at some point, whether today or another time, is how many amazing insulated water bottles there are in the market.
I think maybe next time Kelley's going to do a segment where she just puts all the water bottle types she has on the counter and goes over them and tells us how they're different. Because here I am trying to consolidate and get rid of them because there's too many. They stress me out. Kelley, she's taken them. She is the Patagonia of the Hydro Flask. She's taken them in. She's repurposing them. She's sending them back out to be used in the universe. Like, how many do you have? Like 30?
At least, because I have some here. I have some.
Are they? You're buying them all. You're finding them. You're saving them.
It's a mix. Sometimes they find me. Sometimes I find them.
Wow. Yeah. Maybe if you just want to pick your top 3 or 4, and we'll showcase them on the episode next time. Because I'm not sure.
Great.
We might need a whole spin-off podcast for the Hydro Flasks. But yeah, I learned this about you. Like last year, I didn't know this either. That you really just dig
it's
a
more
water
recent
bottle.
passion of mine. I do. I like my drinks cold because I don't like ice. So
boom, nailed it. Okay, so we decided that it's fun to hear us banter, but we want to get into who we are, how we ended up where we did, and start to eventually talk to people in our lives who are in a similar place but took a completely different path to get here, or are in a different place but we thought we were following the same paths, just to give perspective and be helpful. The Doctors Are In podcast, you talk more about being the doctors. So today, we're going to do a spotlight on Kelley Sharp, my twin sister, the doctor, the dermatologist. Kelley, are you ready to be in the hot seat?
I am. I'm so excited. I love talking about derm.
I love that for you. Okay, so let's just start from the beginning. Tell me a little bit about your career path, starting from high school when you started thinking about medical stuff, just that trajectory of how you ended up in med school.
So if you talk to anybody in medicine, everybody has a bit of a different path. Some people kind of just go straight through. I think more and more commonly, there's a tendency to take a couple years between college, whether that's to study for med school. People have second careers. That's kind of my case. So we grew up in Kansas City, went to University of Kansas for undergrad. I was always somewhat drawn to healthcare. I knew I wanted to help people. I like science. I like seeing things visually and making a difference in an acute manner. So it's like, I think healthcare would be really great. It has a lot of options you can do, work stability, which was always very attractive to me. And so I was always sort of on the fence. Amanda and I's mom, she's a pharmacist. So that was something that was role modeled to me at a young age. That was a potential career. Our Aunt Kay, she is a pediatric emergency room nurse. And so that was always something that I was, interested in. Or I thought, well, I could think about nursing. I could be a pharmacist. I could be a doctor. But to me, at that point, getting 18, 19 years old, the idea of medical school, the long commitment that is, plus years and years of training afterwards, seemed a bit intimidating. And so I was kind of more on the, I want to do something that's a bit more short term and I can guarantee a good, stable career. And so I went down the nursing route, and it was something that I really loved. I went to nursing school. That's actually what my undergraduate is in. I'm Bachelor's of Science in Nursing from the University of Kansas. Go Jayhawks. And I really loved it. Throughout nursing school, as I became more and more exposed to the healthcare field through our clinicals, through our lectures, I realized that I really did love medicine and I wanted to be taking care of people. But when I saw a bit more about what the different roles are in the healthcare team, I found myself identifying more and more with the role of a physician. And that was something that was a little bit scary, because I was like, oh gosh, like, do I want to go for it? Do I want to go to medical school now? Which was a bit of a career change up. So when I was still in nursing school, I started taking all of the prerequisite science courses you need for medical school. Unfortunately, there's all different science level courses. All the ones I did for nursing school, none of them counted for my med school prereqs. So I redid all my basic science courses: biology, chemistry, physics, biochem, all that good stuff. And so I was doing that partially throughout nursing school. When I graduated nursing school, immediately started working as a nurse as well. And then kind of throughout that time was also taking the rest of my science courses to apply to medical school. So that was a really interesting time. And I did 1 year in geriatric psych nursing. So a very specialized, locked in patient unit. I learned a ton. I really loved that population. I loved taking care of them. And I felt like I made a huge difference. It was very challenging, but a really great experience. Then I finished my science courses, went and worked in the emergency room at a big level 1 trauma center here in New England for about a year before I started med school. That was kind of the time when COVID hit as well. So it was, again, a complete shift. Obviously, people were very, very sick. We didn't know a lot. So that was very scary, but I think really reaffirmed my desire to continue in healthcare as a physician, which was my ultimate desire. 2020, I started med school. Med school is 4 years for anybody who is not familiar. Throughout that 4 years, you decide what you want to specialize in, because in medical school, you learn about everything. And then you can narrow it down and you do additional training called residency. Currently, I am a baby doctor. I graduated med school in 2024 and I'm in my dermatology residency now. So I do 3 additional years after 1 year of internal medicine first, just specializing and learning about everything that dermatologists need to know to go out and practice. So I'm in my first year of dermatology residency at this point.
Okay, that was definitely an in-depth summary of how you ended up where you are, which if anyone's wanting to follow in a similar footstep, it's great to hear the path that you took. In terms of interviews, I know we had this for law school. I'm assuming a similar thing for medical school where you're doing so many interviews to get into residencies. So if you had to do a quick elevator pitch, a minute or less of that journey and shrink it into something that's super hard hitting and powerful, but encapsulates most of the important details you just said.
Yeah, I know that's much easier said than done, but I'll give it a shot. So I would say growing up in the Midwest, knew that I was interested in healthcare, but I wasn't sure what that path was going to look like for me. My first career was in nursing. I worked as a nurse for 2 years before starting medical school. During that time, I gained invaluable insight into the healthcare system and really reaffirmed my desire to become a physician. Throughout medical school, I built a lot on that knowledge base already, continued to fall in love with medicine and found a passion for dermatology. And now I'm so excited to continue that training as a dermatologist and learn new things every day.
Amazing. Talk a little bit more about what drew you to derm. And when did you know it was the right specialty for you? How did you just grow up loving zits? What's the 411 there?
Well, you know that I did grow up loving popping pimples. So it's always been a weird obsession of mine. I'm a big Dr. Neil Popper fan, but I struggled really horribly with acne all throughout my adolescence, teenage years, and just very traumatic for me. And so I've had a deep appreciation for the importance of dermatology, skincare, and how big of an impact it can have. I think I'd always thought deep down that I would be interested in things. As I got more exposure throughout medical school, really understanding how unique dermatology is and that it's such a visual field and that we're able to look at somebody's skin for the most part, tell what's going on, even just doing a visual once over. Occasionally we'll do a biopsy where we get more information by taking a sample of the skin and sending it down to the lab. But I love that we're able to look at something, tell you what it is, and a lot of times we can completely cure it or really, really help people and restore their confidence, because the skin is such a personal thing. It's our outward expression and it's also the largest organ in the body. And so it's cool that we get to be the caretakers of that.
It's cool. I know as your sister, you've done the dermatoscope thing to me where we look at a mole and I'm like, what about this one? What about that one? And you're like, good, nothing there, looks normal. Like, it's cool that you're able to kind of,
it's gratifying.
Yeah, you're able to get to those quick answers and obviously sometimes you have to biopsy and send it away. But I think it's great that you're able to have those quick answers as well and provide that, like you said, gratification to the patients of, hey, we're going to help you with the acne. Hopefully it starts to get better tomorrow when you start this medication, rather than you have cancer, let's take chemo for 6 months and see if it gets better, Obviously, oncology is a very valuable subset of medicine, but it's definitely different.
Yeah. And I think that's the thing I didn't understand as much until I went to medical school too. And even now, like, there are so many subspecialties when medicine has become so niche, and that all these specialists know so much about their one field because there's more and more treatments, there's more and more learning every year about the different things that cause different conditions. And so truly the specialists are really kind of the owners of the expertise in that knowledge area. And so it's cool to be able to even collaborate, because we obviously work with oncology sometimes in cases like, say somebody has a really invasive melanoma, like that's a multidisciplinary thing where they're followed with an oncologist for systemic treatment. We're doing their skin checks. Rheumatology is another branch that we work with a lot with people who have these systemic autoimmune type processes. So it's very interesting to get to learn from other subspecialties as well. And that's something I love about medicine, is just how much communication there is.
Similar to what you just said, are there any expectations of the specialty compared to the reality of actually being in it now that you didn't expect, or something that's totally the exact same, like you do get to pop zits and it's great?
Occasionally I do, and that is great. I get to pop zits, but I think that something a lot of people think about dermatologists, like they're just doing Botox all the time. It's so chill. And we are lucky in that it's mainly an outpatient office type clinic setting. So you have regularly normal hours, but I also think that people don't understand that we really do treat a lot of very serious conditions, and a lot of conditions that are systemic have manifestations on the skin before somebody might even know that something else internally is happening. And so a lot of times we are the first ones to diagnose something and then referring for other specialized care. And then also we do take care of some conditions that can be pretty challenging or even life-threatening, or the quality of life for some of these very serious disorders that somebody's entire body surface could be affected. And so although we do treat a lot of acne, we do prescribe a lot of topical steroids, there are also a lot of things that we treat that are pretty serious. And so it's not just zits and Botox, that we treat a lot of other things. And then we also treat skin cancer and cure skin cancer as well.
And the skin is the biggest organ in the body.
I could go on a rant about the sunscreen, but please wear it.
Please wear it. What does a typical day or week look like for you?
Yeah, that's a good question. So as a resident, it's a little bit different, especially because we're like at an academic center. I think if you're an attending in private practice, obviously looks completely different. But for us, office hours are, 8 to 5, Monday through Friday. Recently, I've been on call more frequently, but typically we rotate through each of the residents. We take a bit more call in our first year with our program, but every program is a little bit different. For us, an on-call week looks like you're holding a pager. You might get a page. It's really like hit or miss how many pages you're going to get. Occasionally, we have to go see inpatient consults at our hospital, whereas somebody's admitted either for a skin thing or for something else, and they happen to have a dermatologic concern that arises. We have to go see them. So that can be, a few times a week, potentially. Usually the call is not too burdensome, and it's not something that happens a lot, but that is occasionally. We do end up coming in on the weekends or late at night if somebody has skin surgery complication. So it's not just 8 to 5, but it's pretty good for the most part. Dermatology is like learning a different language. There's so much to learn. So a lot of time spent outside of clinic is spent studying. So although we have a little bit of lighter schedule in terms of we're not working, 18-hour shifts every day, we do spend a few hours every day studying after work. So it kind of catches up in that way, which is fine with me because I like to study. And I think most of us who end up in derm are pretty okay with that. But that is something that I think adds just to the daily workload.
That makes sense. Yeah. And I feel like you're right. A lot of the time the call isn't, you're not having to go into the hospital, but you are having to be there for the patients. And I think it's important for people to see that it is cushy, but you still have to do things as a dermatologist.
Yes.
And maybe this is similar, but what are the most common misconceptions you think people have about dermatology?
Yeah, I think the biggest one, as I was kind of alluding to earlier, was just that it's very surface level and all of the skin is superficial. I think a lot of the things that we treat are very much impacting the person on a deep level. We treat the hair, we treat nails, we treat skin, anything that comes out of our skin. And so people come for hair loss appointments, and it can be really, really devastating on your quality of life. And so a lot of times what we're trying to do as well is understanding how something's impacting somebody, treating them, but then also providing that support and helping in any way we can. So it is surface level in a lot of ways, and that we are looking at the skin, but a lot of the conditions that we treat go a lot deeper than that. And so that's something that we encounter frequently.
That's honestly crazy. I never thought about that your fingernails and your hair come out of your skin.
Yeah.
I don't know if I love it, but there's some kind of saying in there where it's a superficial thing that you focus on, but it's not a superficial job that you do.
Yeah. And I love dermatology. I'm obviously biased, but I think it's not all
picking pimples and then just going away for the day.
Yeah.
If there were a student sitting in front of you right now, what would you say to someone who's thinking about this path and maybe how to find the right version of medicine for them?
Yeah. I would just say that all of healthcare offers so many different opportunities, and that it's so hard to know how each of those roles looks until you get exposure to them. So one of the best things in terms of high school, and you could probably even talk a little bit about the cool program you did in high school, where you actually got your CNA license and got some exposure at that early age, which is really neat. I think that thinking about what are you passionate about? Are you somebody who likes science, who likes the idea of providing care, or looking for answers, talking with people? Because a lot of healthcare also is somewhat customer service oriented. You have to be able to talk with people and understand their perspectives. And so I think that's a big part of what we do. And then kind of finding your niche in terms of where you want to be within that is something that takes a long time. And so I don't think it has to be decided right away. More and more people are kind of coming to medicine through different avenues. So it doesn't have to be, oh, I knew I wanted to be a dermatologist when I was 8 years old, and that was all I could do. I don't think it's ever too late to switch tracks, change your mind, and with more exposure, you will find the right and perfect fit.
Yeah, you're right. I'll talk about it on next episode when we really get into how I ended up in the law, but I definitely
you had an interesting
this
situation.
idyllic idea that I knew what I wanted to do, and it was nursing, and I was going to be the best. And I went in our high school, actually, the Olathe high school system. Each school kind of got their own thing. So one of the schools had a culinary school. You could actually cook things and provide them to people at a restaurant during high school hours. And They had an auto shop, like a mechanic, you could do that. I ended up doing the CNA, the Certified Nursing Assistant program with my best friend Hannah, who we'll probably have on the pod at some point. She's an ER doctor now, but she and I did that together, and it was a semester course at a different school. So we started the day at our primary school, and then we drove to a different high school, and we took that course for the last 2 hours of the day. And we ended up going in and helping Alzheimer's patients at the nursing homes, and it was very eye-opening. I think I should have really understood at that point that nursing wasn't my path. I refused to believe that. I think I was in denial on many things at that point in my life. And so, yeah, I don't like wiping people's butts, and I don't like the vomit, and I don't like the blood, but that will not be what I'm doing as a nurse. It will be different than CNA. That wasn't the case. And so I would like to say anyone who thinks their family's medical, they've heard medicine's a great career monetarily, they've watched Grey's Anatomy and think that would be cool, it might be your path. And if things Kelley is saying resonate with you, if you have some kind of program at your school or in your community, a lot of hospitals let you come in and volunteer. We used to volunteer at Children's Mercy Hospital, where we just guided kids and their parents around the hospital. But get exposure, talk to people, but also get yourself in that OR, in that nursing home, because you can hear about vomiting and you can watch it on Grey's. And then if it happens in real life and you freak out, like, I hate to say it, it's probably not going to be your career unless you do a lot of like cognitive behavioral therapy on how to get rid of that fear.
Yeah, but there's so many different things though within medicine too. That was one thing that I miss about nursing, is that it's like very bedside care oriented. So you're like with the patient, if you're inpatient for 12 hours a day, you're the one who's like giving all the medications, putting in the IV in, putting the catheter in, doing the assessments. And you get to really know people. You're with them for a long time. You're providing that like, direct care. And that's a really wonderful thing to be able to do. And that's the thing, as a physician, you don't get to do a lot of that because you're doing other things. But I agree. I think shadowing is a really powerful thing, especially in college, undergrad, or even in med school. Throughout clinical rotations, you get a lot of exposure. And I think that's one of the better ways to sort of sift through what resonates with you. And I like to make like the two buckets. I'm thinking about for medical specialties, like inpatient versus outpatient are the two big things I think about. And then throughout that, there's infinite combinations of residencies, fellowships, other things you can do, understanding where your priorities are too, how long you want your training to be, how much time you want to be spending in a hospital, if you want kind of more of a work-life balance. It all just depends on what your priorities are.
And you have to love it. At the end of the day, you talking about loving to read the studies. I'm over here reading Patagonia versus Patagonia for fun on a Saturday. Like, you have to love what you're going into, or else it's going to be a pretty shitty life. And you might make a lot of money. You might be super prestigious in your title, but you're not going to be happy. And that's more important than achieving something on paper, is actually loving your life outside of work. And maybe you love your work and it makes your life a lot better. Like I certainly do. And I know you do as well. But don't just pursue something because it's prestigious, or because your family does it, or because someone told you to do it, or you watched it on a show.
Yeah.
Make sure you go out and have those experiences and be honest with yourself at the end of the day. Like I did that CNA thing. I did the Kansas Nurse Academy. I did nursing for 2 years in undergrad, and then I had to switch my major and pivot my whole life.
You got into nursing school.
Yeah,
that
I
was
did.
The craziest thing.
No, it wasn't. I did everything I should have done to get into it. I would have been upset if I hadn't. They just didn't hear my internal screaming of like, we can't be a nurse. But I had all of the stuff on paper. That's the thing.
Yeah.
People will let you in the door. You have to be the one to decide whether it's your path to walk through it, or say, I really love this idea and I really know this is someone else's path. But just because a door opens for you does not mean you need to go through it.
Yeah, it's true.
In terms of skills, clinical things you've learned, bedside manner things, what are the skills you think would be beneficial for someone trying to get into dermatology?
Yeah. So, and this might be partially my nursing background too, but one of the things I try to bring to every patient encounter is just really truly listening to people. It's so easy. We train for so long. You feel you have so much knowledge. And sometimes we'll walk in, I know exactly what somebody has or what their concern is. But a lot of times you and the patient are not aligned on what their experience has been, what they're hoping to get out of something, what they're concerned about. And so I think that the best thing I've always tried to do is truly just listen to the patient, ask open-ended questions, stop talking and let them talk to you, because then you're able to build a much better rapport. You get a sense of where they're coming from. And then that allows you to then form a plan together. And then going forward, have much better results. If somebody really feels like they're being listened to, they have better buy-in to what they're going to be doing. And at the end of the day, most of medicine, especially outpatient medicine, you can prescribe something or say, okay, yeah, this is a plan. This is what we're going to do. I'll see you in a few months. But if the patient doesn't want to do it, or if they don't feel heard, they're not going to, and nothing's going to change. And so that's one of big shifts in medicine too that's been happening over the past few years is really trying to take a patient-centered approach, listening to them and trying to share information in a way that's going to make everybody feel heard and do the most good. And so that's something I try to do.
And as a patient who just yesterday was told by the person who was supposed to be helping me get the prior authorization reviewed that it was going to be denied and that it had been denied, then to have it approved this morning, it's important as a patient to advocate for yourself, because there will be people on every level who are trying to help you. And then there are also people who maybe they're well-meaning, but they just don't have the experience to know that what you're going through is something that you can fight and maybe win at the end of the day. My prior authorization was something I had to go through with my past insurance, and I just really didn't believe, maybe naively, until now it's worked out, and I feel like I was rightfully so thinking this, but I was like, we need to submit it. Why would we not submit the appeal? That doesn't make any sense. Like, worst case, they could say no. And then the person I was going to just kept saying, no, it was denied, no this, no that. And I just was very frustrated. And luckily, I had Kelley on my side to help me work through it and just say, like, is this reasonable? And also, I'm a lawyer, so I just said, I'm going to advocate for myself and give them all this paperwork. And legally, I feel like they can't say no if I've been on this medication for a year and it's been working.
Yeah.
But at the end of the day, I didn't know if that was going to work out for me. Maybe this guy did know something I didn't know. But also, you have to be advocate number one for yourself. No one else is going to do it. And if someone says no, they might be right. Maybe get a second opinion before you just decide like the door is completely closed. Because I think if this guy had listened to me more, I would have felt heard and been more willing to approach it differently. But like you said, if you don't come at it with that, I'm going to do everything I can, and you just automatically start closing doors that I know we could probably open, I'm going to keep pushing and just say, like, let's try until it's completely sealed shut. What is something about this job that you didn't expect?
I think I was hoping I would like it as much as I do. But one of the interesting things about residency and training in general, especially in dermatology, which is a specialty, is that you don't always know what your day-to-day is going to look like, even as a medical student and doing like rotations through something. Like before you actually start a residency or like doing this every day, you don't know if you're actually going to like it as much as you think you're going to. And so I was really hoping that I would, and I really do look forward to my job every single day. I don't dread Mondays coming around anymore. And so that's something I've been really happy about.
Be honest with the med students. There will be times in residency or internal year or whatever it is where you have to have those
Intern
moments
year is a different thing. Yeah.
Yeah. You have to remember the end game and the end goal and keep that in mind on those days that really suck.
Yeah.
I can hear Liberty.
Oh yeah. She came in here.
She's moving around. What's the most challenging part of your job?
So I'd say the most challenging part of my training thus far was intern year, which is
True.
For people who don't know, after medical school, certain residencies, most of the specialties will make you do something called an intern year, or occasionally there's variants of it, but basically you do 1 year before you start your finalized specialty training for several more years, where you do more general medicine or something that's more in the hospital and patient-based. And so I did an internal medicine preliminary year where I was working in the hospital as a medicine resident. And that was a really unique challenge. I like to use the term growth experience, and that I learned a lot. This schedule is completely different than dermatology. You're working 6 days a week, 60, 70 hours a week. It's just a completely different experience. It's emotionally and physically very demanding. You're taking care of very, very sick people. Something I knew I didn't love, especially after working in the ED for a year, was I don't love high acuity things. I don't love life and death situations. I like to have a pretty orderly schedule. I like people that are relatively well. That was just the thing that I wanted to focus on for my training. And so taking care of very, very sick people was very hard on me empathetically. And so that was a really tough year. And also the first year out of medical school, you're learning how to kind of start functioning as a doctor, how to order things. Like the first time I ordered Tylenol, I go like, oh my gosh, I can't believe I just did that. And you're having really hard conversations with patients and their families and trying to navigate all of that, all while doing a lot of other tasks at the same time. So that was the hardest part of my training thus far. Even this year, there's things that come up constantly that you don't know. And so that's just a part of medical education in general, is you're always learning, always realizing you don't know things, and then figuring out how and where to ask for help, which is a skill that I'm constantly working on, and something that I don't think will ever stop, honestly, even when I'm in attending.
Do you think that having a medical partner, medical parents, medical friends impacts your experience in a positive way, that you're able to go to those people? Or do you think it's hard sometimes because there's a lot of cooks in the kitchen when it comes to advice?
Yeah, that's a great question. I feel like my situation's a little bit unique. So for those who don't know, my husband, is also a dermatologist. He has a very intimate knowledge of what my day-to-day looks like. And so I think that's helpful from an understanding that we can kind of share things related to what I'm going through, understands what I'm talking about. That being said, though, I do think that throughout medical school, even before I had gotten into derm residency, talking with classmates or like Hannah, like you were saying, who's an ED doc, a totally different career. It's a very, very different job than what I do now. I think it still is helpful though to get a sense of like, oh, you're going through this too. We can all kind of relate to this. And then also like even just talking with you, like obviously I've never been to medical school, but you've been to law school, you know what graduate training looks like. And I just having support systems in and out of medicine is really important. Sometimes you also just have to not listen to anybody else and trust your gut because you can get conflicting advice depending on the situation. But at the end of the day, I would actually say the most important factor that got me through my medical training, through intern year, even now, is the support of our family and friends.
And before we do our lightning round, what is the thing that you love most about your job?
So I started derm residency in July, and for the past few months, I've started to see my patients back now. So I've got a continuity clinic where I see patients, and some of the people I saw over the summer coming back for 3, 4, 5, 6 month checkups. And I'm starting to see the plan we're working on. Is your acne getting any better? And a lot of times people have been getting better, which is very gratifying. And I think that that's something I hadn't gotten to experience as much in medical school or even last year in the hospital with people being really sick and then going home and you don't see them again. And so getting to have this longitudinal relationship and getting feedback, oh, this didn't work, or this is really going well. It's really making me feel more like a doctor. And it's really nice to see people getting better. So that's something I've really, really loved so far.
Yeah, and for all of those who hear like that weird small moaning, it's Liberty, Kelly's dog in the background.
Let me figure it out.
Yeah, can you show us? Liberty!
Liberty! But she's not going to
Liberty!
sit. Sit. Can't.
Hi,
She's not having
Liberty.
it.
Hi, Liberty. Hi. And you got to say that you're
It's
keeping good
sorry.
notes of the people, right? That you're taking, because it's important to keep good
Oh,
notes.
yeah, I agree. I think one of the more challenging things about medical training as well as the documentation, because in derm, it's pretty straightforward for the most part, but the documentation is one of those things that's ongoing all the time. It's so inherent to the job. It's something you just get used to. But yeah, documentation is really important.
You can't spell documentation without doc.
True. And one thing I've loved is learning how to like use dictation software. In medical school, you'd see the residents like talking into their phones or the little boxes. I used to think I'd be so embarrassed to like just talk to myself, but now I like can't type anymore. I just talk constantly.
Lately, I've gotten into an issue is when I try to do a voice note and I forget it's a voice note and not dictation, and I'll be like, "Hey!" exclamation point. How's your day going? Question mark. And then I realize, and then in the voice note, I have to say, I realize this is a voice note. I thought it was dictation. Just pretend I didn't say that.
I've literally left people messages before because I've been dictating all day, and then I'm like, "Hey, it's Dr. Sharp, period." And I'm like, "Oh my gosh, that's so embarrassing." But you just get used to talking like that. Yeah.
They're just hoping that they didn't hear you say period.
Yeah.
So, quick lightning round. What skin condition or cases do you find most rewarding to treat?
My favorite skin condition to treat is something called actinic keratosis. They're precancers. Those little scaly, rough patches, typically in the later part of life. People get them from chronic sun exposure. About 1% of them each year is going to turn into like a full-blown skin cancer. So we treat them, and typically we'll use the liquid nitrogen to treat them. So we just freeze them. And it's very satisfying to be able to just take care of them before they're progressing into something more dangerous for somebody.
Like a wart.
They're they're like warts, but they're not warts.
No,
we
but
freeze
you
them.
freeze them off like
Yes.
warts.
Yes, it's the same thing. Yeah, the liquid nitrogen.
Amazing. How do you approach patient education around chronic conditions like acne, eczema, and psoriasis?
So that's a good question. So that's one that involves a lot of communication and education for people. It's trying to frame it. It's like any other chronic condition like high blood pressure, diabetes, acne, give or take. Some people will have that for a certain period of life and then grow out of it. And same with psoriasis, eczema, but a lot of these things are chronic in nature. And so getting people to really understand, I can give you a cream or something to treat this now, but it's going to be an ongoing thing where you need to work to avoid certain triggers, fragrance products, other things are going to break out your skin, in addition to the treatment we're doing. So a lot of it is this lifestyle modification that people have to really buy into. And that involves providing handouts, educational materials, really making sure that people understand what is and is not going to help their skin is a big part of treating those.
Do you ever have people come in and say, I saw something on TV, I want to talk to you about it, like those commercials that say, ask your doctor about?
Yeah.
The minute,
No,
whatever.
it's true. It's true. Yes. Yes.
Do you always say, tell me
It
more?
depends. It depends. So sometimes it will actually be aligning with what I was going to say. Like they have very bad psoriasis. You want to put them on some sort of like biologic medication, like Skyrizi, or people see the commercials or
Yes,
Dupixent for eczema. And I'm like, that's a really good option for you. There's a lot of people who feel very empowered by seeing those commercials, thinking this might be something that helps me. Sometimes it fits. Sometimes it's for something completely different. I could see why you'd think that. But actually, I don't think it's going to help because you have something else that's going on, or you have this contraindication in your past medical history where this isn't going to be an appropriate thing for you. So understanding and validating people when they're trying to do their own research is really important. It's important to have the conversation of like, this is your case by case scenario. Like these are the factors that make you unique. Why this may or may not be a good idea for you.
Yeah, and to your point, it's important not only to educate the patients and for them to educate themselves prior to coming to you, but for the doctors to stay up to date on cutting edge advancements and drugs that are new, because that's, I think, my biggest issue I've had with Auvelity. They just started doing commercials, which shout out to whoever's on their marketing team for doing that, but nobody seems to know what this drug is. I'm probably the only one who talks about it on a daily basis on the interwebs, and it's through this podcast. So me going to my PCP and him being like, I've never heard of that, and then just dismissing it, I had to keep fighting for it. But at the same time, he could have used that as an opportunity to say, I'm going to look into this, figure out what she's talking about, and maybe see if I can prescribe it to additional patients in the future who had a similar situation prior to starting this.
Yeah, I think the inertia to starting something new for a practicing physician is pretty high. As residents, we're so used to like reading, we're constantly learning. So we're a bit more flexible in terms of like up-to-date things than maybe somebody who's like on prior practice. In general medicine, especially dermatology, like new things are coming out all the time. And so if you're not staying up to date, it's definitely easy to kind of get behind the curve a bit.
And it does a disservice to your patients who are coming to you expecting you to be knowledgeable on all things dermatology. What's one thing you wish every patient understood before coming to an appointment?
One thing I wish people understood is that most things, aside from me shaving off a skin tag that's going to be done that day, take time. And so the skin in general, acne, eczema, all these things, for the most part, specifically acne, take months of treatment typically to start seeing an effect. And so a lot of it, unfortunately, is not overnight. A lot of it involves consistency with a routine, or if you're taking systemic medications, but it's somewhat of a patient's game and really having buy-in. And so that's why I think that relationship of like the patient understanding I need to be doing something every day in order to make my skin better is really, really important. Because unfortunately, a lot of times people don't necessarily know that. They use something for a couple of days and then they don't see any effect and stop. And unfortunately, sometimes it just takes a lot longer.
Yeah, that makes sense. And if they have a setback, I'm sure they are less incentivized to continue on. It just takes one misstep and fall off the wagon of the program for it to have counterintuitive effects. Dude, you said a patient's game. That could literally be such a good, I don't know if it's a book or a segment of the podcast, but a patient's game, but spelled like patient, medical patient instead of patients. Get it? Okay, but I wrote that down. Anyways, where do you see the field heading in the next decade?
In the next decade, I think we'll continue to have some really exciting advancements. Like in the past decade alone, with the more regular use of biologic treatments for these more systemic conditions, we've really been able to provide options for patients that are less globally immunosuppressive, where we're not just slapping them with tons of prednisone all the time, or even topical steroids. And so we're able to target things a lot more specifically. And I think that over the next decade or so, that will become even more specific. So that's very exciting to be able to offer people things that are more targeted to what they're going through and being more effective without some of the higher risk profiles.
How do you maintain curiosity and avoid burnout in such a demanding career?
So the thing I have found,
scuba diving.
Scuba diving, that's the answer. No, I think continuing to have hobbies outside of medicine is really important in learning to leave work at work. Obviously, we have a pretty favorable work-life balance in dermatology, and that our clinic schedule leaves us with most of our weekends pretty free to explore other things, which is really nice. Another thing that I found that's really maintained my curiosity for it, obviously, there's so much I don't know. And so it's very easy to be excited about like learning new things because I've never seen these things before. But one thing I've really enjoyed is when somebody comes into clinic with something I've never heard about, or I'm treating something, using that patient example of my mind and like making it a personal connection makes it easier for me to learn about things. And so like thinking back to me, oh yeah, this person had this, or this is how it impacted them. They did this medication. This really worked well for them is a really nice like vignette example that I think back to and makes it easier for me to learn from.
Do you ever talk to your colleagues about, I had this case and it worked with this, and then you use that, or is it pretty siloed?
All the time. No, all the time. So the residents, we talk about things all the time. And then it's cool in our program because you're working with a different attending who's like a supervising doctor every day. And so you get a sense of this is the style that they like to do for this certain condition. And then everybody approaches things a little bit differently. And so there's a lot of like formal education where you're reading a textbook or you're going to a lecture, but then also a lot of informal case by case examples that you see in clinic with people. And so a lot of that is just seeing what different attendings like. And then also as residents, we discuss things and help each other out.
And final question for your segment, Kelley. You've done such a great job. If you could go back to your younger self and relay one piece of career advice or advice on this journey so far, how you've gotten to where you are, what would it be and why?
I would just tell myself I'm exactly where I need to be. I was so stressed. I used to think, oh, am I going to end up like liking what I'm doing? Should I be a nurse? Should I be a doctor? Like, what if I choose the wrong thing? And I can't imagine having gotten where I am any other way. And it would have been a disservice to not have all the experiences that led me to this point because it makes me a better version of myself at this time. So I just say that every experience is a valuable one. Really learning from each opportunity you're given and being open to the opportunities that life opens up is really important. And then just trying to enjoy the present moment as much as you can, even throughout medical training, even though it's stressful. There's a lot of joy. I had my most fun experiences in the past 10 years, obviously, out training. And so trying to appreciate each day for what it is and just remembering that the road is long and the days are, long, but the years are short.
Amazing. And if people want to go out and find a dermatologist, what do you think the best way? Obviously, unless they live near you, they're not going to come to you. But what do you think the best way for them to go about like starting their skin journey is?
So I would say first and foremost, every single person should be wearing sunscreen every day. And I know that's not a popular take, but at least an SPF of 30 and above, at least facial sunscreen. Put it on your face, and then also don't forget your neck. It's getting a lot of sun exposure on your ears. Wear a sun hat.
Neck, you guys.
If you don't want to be like me and wear a long sleeve swimsuit, that's okay, but please protect your skin. In the sun, you have to reapply your sunscreen at least every 2 hours, more frequently if you're getting in the water. And so that would be my first and foremost advice. Sunscreen. It helps prevent skin cancer, helps prevent photo aging, will make your skin look better in the long term.
Amazing. We'll link to Kelley's favorite sunscreen things down below in the show notes. Thank you for sharing all of that wisdom with us, Kelley. We really appreciate it. Next week, I will be going, so maybe just skip that episode. But our second iteration of things that feel illegal but aren't.
There's so many of them.
We have a long list.
I'm going to get in trouble.
So the first one is when you pay for food and then you just leave, or you pay for something ahead of time and then you just go pick it up like in the Panera and you don't show anyone anything. It's just on the shelf. And you're like, I promise I did it. I'll show it to you. And nobody cares and nobody's watching. You could so easily steal people's stuff, but you don't. It's the honor system.
Yeah.
And maybe that's wholesome that society works that way. And maybe it's a little bit delusional, but it definitely feels illegal. And it isn't.
It for sure feels illegal. Even when I leave the grocery store and do self-checkout, I keep the receipt because I don't know.
Yeah, I'm like
paranoid.
scanning.
Did I just forget to just buy all this and I'm leaving now? Like, I don't know. Maybe.
And I make sure people look and like whoever is monitoring it as the employee makes eye contact. I say something funny to them. I'm like staring down the little camera because got it. You're watching me.
But
I'm
also,
watching me.
I've never felt uglier than in one of those cameras. Specifically the Target camera. There's something bad happening there. It's rude, actually.
They don't.
I'm like, there's no way they want you bad.
They're basically encouraging people to stay for less time because who wants to sit there and be watched like that? They need to make it more glamorous. So you're like, wow, let me find another pack of gum.
Yeah.
Let me take some photos. Yeah.
It's like the worst angle. Right. I look like Gollum. I don't know.
Yeah, somehow I'm always looking like this. I do not look like that in real life. Or, dressing room mirrors. Sometimes they're great. Sometimes they're not.
But I haven't shopped in a real store in I don't know how long.
Yeah. The other day I tried on clothing and it was really awkward because Mom came into the room with me, but I wasn't wearing underwear and we were trying on pants and I was like, I'm not wearing any underwear. Like,
why weren't you wearing underwear? Also, that should be illegal, but isn't wearing pants without underwear. That might be illegal.
That's like a gray area for sure.
No.
Oh, I know what it was. No, I was totally justified. I was wearing yoga pants because I was about to go to yoga. And I didn't wear underwear with the yoga pants because that's crazy. So I was taking the yoga pants off.
You don't wear underwear with your yoga pants?
No, because I have found that it gives more breathing ability. And there's less issues there. But anyways, I was wearing yoga pants, and normally I don't wear yoga pants, but I needed to try on shorts for this tournament I was going to in Palm Desert, and I had to wear shorts. And I didn't realize I wasn't wearing underpants until Mom got into the dressing room with me, and I was like, I'm not wearing any. But they do put those little stickers. Actually, these were men's pants, so it didn't even really matter because they didn't have the stickers.
I know. Yeah, I know what you mean.
Which is also
the
weird. Now that I'm
stickers are, I
saying
guess, in place in case people are not wearing underwear.
I guess men always wear underwear and women don't because the men did not have that. So I don't know. We're losing the thread. We're losing the thread.
Okay.
Another thing that feels illegal. Charging more for gluten-free food and or ingredients. Allegedly, it's more expensive. I don't know how because you're making it with something else that's not flour or whatever, but it just feels illegal. Like, it's not my choice to be gluten-free. It's a dietary need. So how can you tell me it's going to be
discriminatory at the very least?
Yeah, if we had a better administration, I would say let's get on that. But at this point, we're just fighting for our lives and regular human rights. So this is low priority, but
I agree.
I do want to make a special announcement. In these trying times, we need all the good news we can get. Drumroll, Cheez-It finally told us, they finally said gluten-free Cheez-Its are coming in February, which could literally be as of tomorrow. They're shipping out. I don't know where they're going to be or when they're going to be there, but February at some point, whoever finds the first box and sends it to me, I'll give you $50. I want to try these things. I've been waiting to eat Cheez-Its since I stopped eating gluten like 4 or 5 years ago. Please,
I think they're going to translate really well as well. I could see them being good gluten-free options.
They are. Oreos taste no different. Tate's cookies taste no different because they don't need to rise. Cheez-Its have always had the perfect consistency for gluten-free. I don't know why it's taken them so long, but I just think it's important. I will pay more. Even though I just said it's annoying, I will pay more for the gluten-free Cheez-Its. Just tell me where they are, please.
The exception
someone out
you can
there.
Make. This is one I feel strongly about, actually, that I think might actually be illegal, is eating food in the grocery store before you buy it. That's like psychopathic to me. Why are you opening your chips before you buy them? Also, then you're touching everything in the grocery store while you're eating. I don't know.
I think wrong. It's a weird, because like grapes, I see people do it with grapes. I've seen people do it.
Maybe like a single grape. If you wanted to like test, maybe I could kind of appreciate that. But I've seen people like straight up open like a box of something.
I've never seen that. I do think
I have seen that.
I think it's illegal until you buy it. But I think if you haven't bought it yet, I do think it's illegal. But then once you buy it, I think it transfers to yours. It's like borrowing money from a bank. You're borrowing the groceries from the store with the intention of paying for it later. But the store didn't agree to it. Whereas with a loan, the bank has to agree to it.
It's just, I think it's sketchy behavior.
Yeah, it definitely feels illegal. It feels illegal when I see someone else do it because I'm like, should you be doing that?
Yeah.
Anytime I feel like I should tell the teacher if we were in a schoolroom, that's when I start to get the illegal vibes. And that feels illegal. You're right. Especially chips or something that's not going to easily close up. Like if it's resealable, it's a little bit more of a gray zone. But
one more thing I do want to add to the things that feel illegal but aren't, but does make you a shitty person. Not returning your cart in the parking lot.
I agree. What is up with that?
Don't leave that in the middle of the parking lot or another parking space. Like it's going to roll into someone's car. Somebody else has to go get it then. Like if you're going to use the cart, please put it back.
Please put it back.
And that's all I'll say on that.
I don't know if this is illegal, but I think it might be in certain jurisdictions. When your dog poops and you don't pick it up. Fun story today.
Pick it up.
I went to the bay to run with Cooper and it was a very chaotic couple minutes at the beginning because in my running, I had this little side pack where his little treats and his bags are. The bags decided to escape and go on a little joyride. So they got lost in the grass. So about a half a mile later, Cooper poops. A bunch of people are walking by. It's a heavy traffic area. Cooper's pooped and everyone has seen it. And I just have to pretend to look for a bag in this thing until all the people who were in the vicinity are away. And then I have to proceed to leave it and go look for the bags in the hopes I find them. Otherwise, I'm just going to have to get in my car and go straight home.
And never come back.
Never. I'm just going to have to move back to Kansas. Yeah. I did find them in the grass. I walked right back. I threw them away. But I saw this man later on who saw me see the poop, see there was no bag, look around at my thing for a while. I think he clocked that I wasn't going to pick it up. And then I think he clocked that I walked away. And then he saw me later. And this man turned around like while I was running. And I wanted to be like, sir, I did pick it up. But you could just tell he was like, that little. She didn't pick that up, but I did. So that feels illegal, and it probably is in certain areas.
Yeah,
but
that's highly stressful.
It's just unhinged behavior. So
yes,
pick up the poop, you guys. That's the scoop. Okay, a moment straight for the allies. It is almost the Super Bowl. Nobody I care about is in it.
I don't
Some
care.
teams I don't care about are in it, so whatever. But I'd like to give a shout out to Trey McBride. He is a tight end for the Arizona Cardinals. This year, he set some NFL record for catches in a single season, but he has 2 moms. He is the only professional NFL player with 2 moms that I know of. There's been no one else who's been outwardly public about it. And I love that he's public about it. And he was on my fantasy team and he did great. And he's a great ally for just bringing up that he has 2 moms, because now if I want to have a kid and I want them to be an NFL player, I believe it's possible because Trey McBride showed me it's possible. So a moment here for the allies. He's the ally of the week. And I wish he was in the Super Bowl, but he's not. That would make this more cohesive. But good for you, Trey. Keep being
Thanks,
you.
Trey.
Love you. Great ally. And final segment, Midwest versus the Coasts. We'll have to come up with a better name for it at some point. That's the name right now. A couple of things about the Midwest that don't transfer here. When I run into someone and I'm like, oh, just subconsciously I do it. I can't stop it. It just happens.
No.
It's automatically. It just is part of me. It would be like if I hit something and it made a noise, like I have to say it. But nobody here does that. And so they know I'm automatically not from here when I do it.
Yeah. Just gotta squeeze past you.
Oh. And then
it's like a primal scream. You just can't help it. It comes out.
But it's so tender in nature. Like it's not at all primal.
I suppose, yeah. By primal, I just meant it's like just part of us. It's just intrinsic.
It's intrinsic.
I like it.
It's something to say rather than like, oops, that's weird. And then when people say nothing, I'm like, you need to at least acknowledge we almost collided.
Yeah.
So, but I noticed that I do that and people don't do that here and it makes me feel different, but it's okay. Another thing people really get upset about here, and I don't want to hear it. I will not subscribe to this idea that the other day is not an appropriate description for any day that isn't today. People here get so upset when I say the other day. They're like, what do you mean, Amanda? I'm like, 2 months ago. No, they say the other day is within the week, probably the last couple of days. No, that's what the last couple of days is for. On Tuesday, that would be easy. That's a day that was recent. On Tuesday, this happened. But the other day, I don't know. When I tell you a story, I'm not going to be like, September 2024. I'm going to say the other day. And then when they say, when was it? And I say, back when I graduated college, and they get upset. Is that just a Midwest thing? Is it just a me thing? Like, does that happen to you?
I think it might be our family thing. And maybe more of a Southern thing, because I think a lot of it is more with Dad's Oklahoma side. But I also am like the other day, for any other day that is not today. It's usually several years ago. Or more
it's usually at least a month or 2 ago. At least.
Yeah. But I think the other day it's what you want it to be, right? It's like, it doesn't subscribe to the rules. It's up for interpretation. And it's a beautiful thing that shouldn't be censored.
Yeah. I just think we're talking too much about it, to be honest. I shouldn't have even given it time on the podcast because it's just ludicrous that people have a problem
I do
with this.
agree.
Jervelyn, I know you're listening to this. The other day is respectable. And now she started saying it. And she's the one who gives me the most shit about it. And I think that it's
a
funny.
Really nice thing just to have it add in the mix.
Yeah, just add it in. You don't have to use it exclusively, but just to have it in the repertoire, to just pull it out when you don't know how to describe that day something happened the other day. Now you know.
A different day than today.
And with that does it for our second episode of The Doctors Are In, the sharpest podcast out there.
Thanks for tuning in. Please share with your friends. Subscribe anywhere the podcasts are offered. And until next time,
be pretty good
and stay sharp.
Your team together, they're a power dream. The doctors are in, let the show begin. Double the wisdom, double the grin. From the courtroom to the ER spin, they've got the cure. Let's dive right in.
We're losing everyone. We're losing all the good ones.
I know. That was not a good one to lose.
I was gonna say something. God damn it. I was gonna say something about mom and dad.
No.
Okay, whatever.